Welcome to NCPDP, Unscripted, the podcast where healthcare meets real talk. Each episode, we will dive into unscripted conversations with industry leaders, changemakers, and innovators, discussing the challenges, breakthroughs, and behind-the-scenes stories you won't hear anywhere else. Whether you're on your morning commute or taking a break between meetings, settle in because it's time to get unscripted.
Well, Meg, welcome to our new podcast, NCPDP Unscripted. Excited to have you on the show.
Yeah, thank you so much for having me.
Yeah,
Excited to be here.
absolutely. I feel like we've been here at the annual conference for a few days, and I don't think I've seen you. You must have been really busy.
Flying by, all good.
Yeah, good,
Yeah.
good. Well, I'm sure our members know who you are, but I'm sure some of our listeners probably don't. So why don't we have you start with introducing yourself?
Yeah, so my name's Meg Murphy, and I am the Pharmacy and Regulatory Affairs Manager at Surescripts. I've been with Surescripts for about 2 years now, and in this role, I've focused primarily on leading and advocating for various initiatives to advance pharmacy practice with a focus on advancing pharmacy interoperability, of course, and co-chairing with Pooja, the pharmacy work group through the Sequoia project. So that's really been kind of where my work has focused thus far.
Fantastic. Yeah, I'm excited to dive into this conversation. So I know you're a pharmacist, and prior to being at Surescripts, you were involved at the American Pharmacists Associations. Oh, we have the pause for pause behind us. At APHA Foundation. So just wanted to kind of get your take. I think, the pharmacy profession has obviously changed over the past probably 3 to 5 years. Would love to just kind of better understand, you as a pharmacist, how you've seen that change.
Yeah, so I've seen a lot of changes in the past 5 years. It's, thinking back to May of 2020 and what has, transpired in the years after that. I think there's sort of two key themes that stand out to me in those last 5 years. Obviously, the pandemic is one of them, and that's really shaped and evolved how pharmacists practice and how they're seen by the public and policymakers and other providers, which I think is really positive. And then I think on maybe the less positive side of things, there's really been mounting financial pressures that have resulted in pharmacies closing and really kind of then this recognition within the pharmacy profession of being kind of a little bit more vocal about how important, how critical that reimbursement and recognition is for the services that pharmacists are providing. So I think those are kind of the two biggest things. But it's funny because when I was at APHA, I had the opportunity, I suppose, to really lean into all of the support that we were providing to pharmacists during the pandemic. And actually, one of the ways that we were doing that was through a weekly webinar. And so I looked back, and on May 7th, 2025, we were talking to Randy McDonough, who is now APHA's president, and Michael Hogue, now APHA's CEO, was interviewing him about what pharmacists need to be doing. And Randy was talking about how he was going out and educating public health leaders in his community that pharmacies and pharmacists could expand access to testing, and pharmacies could be testing centers. And so when you just think back to that very start of things in May of 2020 to the millions of tests and vaccines that pharmacists have provided since then, I just think it's an incredible arc.
So let's talk a little bit about what's happening at the Sequoia project. You and I are co-chairs, and that's really about kind of looking at, what pharmacists are doing in these clinical services. You want to talk a little bit about that?
Yeah. So I think that is pretty unique to the pharmacy work group. The focus is really around how to better support and scale the services that pharmacists are providing by really digging into, what are those information exchange needs, how do systems need to evolve to support that type of care that's now being provided alongside some of those, very traditional dispensing services that we think of. And so that's, really one of the key elements of the work group. But I think what's really unique about the Sequoia project, and I'll just kind of give some background on the Sequoia project in general, because they're a nonprofit with a mission to advance interoperability. And so their over 100 members really span across the industry. And so I think having the Sequoia project recognize that pharmacists need to be connected in better to the rest of that care team, and kind of also signaling, right, that the care team wants to be connected to the pharmacist.
Yeah.
I think that's just really exciting, and it's been an awesome way to kind of bring awareness to all of the good work that we know is also happening,
Right.
in tandem at NCPDP,
Yeah.
through the Pharmacy HIT Collaborative, and other efforts. So
Yeah, what I love the most, and I remember this in our very first meeting, was, it wasn't just pharmacy folks, and of course, we have, farmers folks on the call, but you had health plans, you had providers, you had, QHIN, so it was great to see that interest, right, as opposed to
Yes.
us just talking to each other all the
Yeah.
time in these meetings. It was really great to see that, and I see more and more interest from those additional groups, and kind of, hey, what are you guys doing at that pharmacy work group, which is exciting.
absolutely,
Yeah,
I would agree.
fantastic. So, you're currently at Surescripts. I know, Surescripts and AHIP, which is the American Health Plan Association,
Yes.
and APHA did a summit probably a year and a half ago, maybe.
Yeah, last summer.
Last summer to talk about, what, of course, as you mentioned earlier about kind of the reimbursement, right? So it's great that pharmacists are doing this testing, additional services, but, how do they get more involved at the health plan? Would love to better understand kind of what came out of that, and what we're seeing out of that effort as well.
Yeah, so we were really excited to be able to bring together, our health plan partners with our longtime pharmacy partners last summer to talk about how to strengthen payer pharmacy partnerships. And I think what's interesting is, so APHA, they'll track sort of where reimbursement stands across the country. And today in 43 states, at least one service is being covered by either, commercial plans or Medicaid. And so we can see that reimbursement landscape is really maturing. In about half of those states, there's actually mandates in place to some extent that say, plans need to cover pharmacists for providing these services.
Yeah.
But then at the same time, there's really no necessarily mandate needed, no policy needed to stipulate that, pharmacies and payers work together today. That's something that pharmacies and payers can do right now. So
Right.
at that summit, we had some really great dialogue about where that, relationship kind of stands, what some of those missing pieces are. And I think interestingly, to us, obviously at Surescripts, was that one of the, kind of points of consensus was there's a lot of really awesome successes that are happening in, pockets around the country today where
Right.
pharmacists are providing care, but without the technology and that information exchange between the health plan and the payer,
Yeah.
or the payer and the pharmacy,
Yeah.
there's not that ability to scale some of those successes at the speed that we would hope to see. So
Yeah, absolutely. And I think that, obviously before joining NCPDP, I was a consultant, and I remember doing some projects, and, people are piloting things, right? But then when you ask them, they say, I'm emailing patient lists, or I'm,
Right.
putting things on spreadsheets. And then I would ask them how they're reimbursing the pharmacy, and they'd be like, oh, we write a manual check. So, we know there's electronic ways to do it. At NCPDP, we have the pharmacist e-care plan. So there's electronic ways to do it, but I think, kind of figuring that out,
Yes.
especially as more and more health plans and pharmacists are looking to work together. So
Absolutely. And I think, one of the really positive pieces that came out of the summit was really just more dialogue and more of a focus on some of these things.
Yeah.
I know, APHA is doing a lot of work to advance those collaborations between, payers and pharmacy, and there's other organizations that are really, starting to look at this and look at what role they can play in moving it forward, which is really great to see.
Yeah, definitely. And I know we also have a health plan subcommittee, which I think you're on as well.
Yes,
So
yeah.
that's great. So I want to shift a little bit more to data exchange. So obviously, I think just a couple weeks ago, it was announced that Surescripts is officially a QHIN under TEFCA. So for those listeners that are listening, TEFCA is the Trusted Exchange and Common
Framework and Common
right,
Agreement.
framework and common
I have it written
agreement.
down because is, a
Yeah, it's always
mouthful.
hard to remember, but
Yeah.
basically a common way to have data exchange, kind of across the nation.
Right.
So would love for you to share, kind of how you guys are approaching that and, what Surescripts' role is in that.
Yeah, so Surescripts is now a designated qualified health information network, or QHIN, and so really under that umbrella of TEFCA that sort of governs this nationwide data exchange, the QHINs are really a network in and of themselves in actually exchanging that key information, clinical information, and really kind of creating a network of networks. And so Surescripts is now a designated QHIN and an opportunity to connect in to that broader nationwide exchange. Specifically, with pharmacy, we have a long history of collaborating with pharmacy, and we really want to see pharmacy be a part of this really future of interoperability. It's really taking interoperability to the next level, and we really want to see pharmacy a part of that. So it's one of the focuses that we'll be having more conversation through the Sequoia pharmacy workgroup in terms of what that really looks like. What's the best way to kind of harness that upgrade to interoperability in a way that makes sense for pharmacy. But I think, the promise that it holds, right, is that in today's, world, pharmacies are often navigating connections to multiple different, HIEs, EHRs, and the promise is that in this landscape in the future, you'd really be able to have sort of one single secure connection to that broader, ecosystem and be able to exchange information through that one source. So that's
fantastic.
Excitement there.
Yeah, very exciting.
Yeah.
It was great to see that. All right, so I know we're down kind of to the last minute. So what's your vision, kind of the future vision for the pharmacist? What's your kind of ideal state?
Yeah. Well, so I like to say that I think the future pharmacy needs to be collaborative, connected, and compensated. So collaborative in the sense that, pharmacists are able to utilize the full extent of their education and training, and as are other members of the care team, really kind of collaboratively harnessing all that expertise in a way that makes sense. And then, connected, of course, for all the reasons that we're talking about today, and compensated similarly, because we know that without coverage for patients and compensation for the pharmacists providing these care services, that there, is no future, right, in that regard. So.
Yeah, well, and I love the connected because our annual conference theme was connected care, right?
Exactly.
And how do we bring pharmacists in the fold?
Right on theme.
Yeah, exactly. So Meg, this was great. Thank you for joining me today. Really excited. And, for those that are interested, that want to join the Sequoia work group, definitely go on the website, right? And think about joining us.
We're in our early stages, so still time to join us. And thank you so much for having me and for all the incredible work that NCPDP is doing to move things forward for the profession of pharmacy.
Yeah, thanks, Meg.
That's a wrap on this episode of NCPDP Unscripted. Thanks for joining us as we explore the voices and ideas driving innovation in healthcare. If you'd like to be a guest on the show or have topic ideas you'd love to hear us cover, we want to hear from you. Until next time, stay curious, stay connected, and stay unscripted. Our podcast is proudly sponsored by Marks Productions.